Good morning, everybody. This is Carolyn Hart with John Snow Incorporated, and I'm delighted to be on Facebook Live today with three good friends and colleagues. We're going to go ahead and get started right on time because it's been our experience that we get a lot of viewers who come to Facebook after the event and watch that way. So we don't want to have them have a lot of waiting time at the beginning of their experience. So we're just going to jump in. And I would ask people who join us, if you would like to, please let us know where you're joining from in the comments section. We'd love to see that. We are coming to you today from 4 different corners of the world. I'm in Washington or outside Washington, D.C. Matiko Machagge is in Dar es Salaam, Tanzania. Dr. Loko Abraham is in Addis Ababa, Ethiopia, and Suzanne Veit is in Woerden in the Netherlands. It's a great pleasure for me to be here with you with these 3 colleagues, and I'm just going to do a quick introduction and then sort of be the MC and put questions to them about their work. This is the first of a series of 3 conversations on global health supply chain best practices in 2021 and beyond. And these 3 colleagues today, just quickly, are going to speak about their experience from in their current roles and I guess their career experience as well. Loko Abraham is JSI's project director for the USAID funded digital health activity in Ethiopia. It's the largest bilateral health information system project in the world, and DHA works to fully digitize the national health supply chain in Ethiopia to ensure end-to-end visibility. Before joining JSI, Loko came to us from, or he served as the chief executive of the Ethiopian Pharmaceutical Supply Chain Agency, which manages 80% of the national drug, medicine, supplies, vaccines, and medical equipment in Ethiopia. And he was also a senior supply chain advisor, or the senior supply chain and quality of care advisor to the Minister of Health in Ethiopia. It's great to have you with us this morning, this afternoon, Loko, but also more generally as a JSI colleague. Matiko Machagge is with the organization called inSupply Health, which is an East African health advisory firm. Matiko is the Tanzania practice lead, and he comes with over a dozen years of experience improving, strengthening health supply chains, particularly in East Africa. The inSupply mission, inSupply is actually an affiliate of JSI Research and Training Institute, and its mission is to transform lives in Africa by co-creating innovative and sustainable solutions for healthy communities. And Suzanne Veit comes to us from another JSI affiliate organization called the Partnership for Supply Chain Management. Suzanne is the Pooled Procurement Project Director for PFSCM, and she's based in the Netherlands, as I think I mentioned. PFSCM is a procurement agency and a 4PL services provider, serving donors and country governments and NGOs as well. PFSCM specializes in health products for COVID, HIV, malaria, tuberculosis, and more. And more than 90% of PFSCM's volumes are destined for Africa. So at PFSCM, Suzanne oversees all of their procurement and logistics services for the Global Fund to fight AIDS, TB, and malaria. So with those introductions, I would like to let us get started. So I'm just going to sort of do a run of the room and ask each of you a question and then come back around for another round. So again, please respond to the questions, but more generally share your experience. So Loko, when you think about this past year, which was a heck of a year for all of us, what lessons did you learn from your supply chain work over this past year?
Thank you, Carolyn. So it's been a very, very tough year globally because of the COVID-19 pandemic, and it has particularly been, quite a challenge for global supply chain systems and national supply chain systems. Over the past year, I've I've come to realize that we still need, huge work endeavor to actually make sure that health supply chain systems, both at national and global level, need huge investment to make them resilient. So I think that's one thing which has been proven in the past year. Second issue again related with the COVID pandemic is, we can basically say the major disruption has been COVID-19 for all countries. Ethiopia in particular had a few issues related to security on top of COVID-19, but the responses to similar disruption has not been the same globally. So I think I've learned that we need to make sure that we have context-specific response to disruptions, particularly in the health supply chain. Maybe last piece related to our ongoing work and the digital health activity is it has even become more important to make sure that we have end-to-end visibility into our national supply chain systems, and also work more on making sure that we have visibility into the global supply chain. That it was very difficult for people to move around, take stock counts from facilities. So I think it's a very high time to invest more to make sure that we have visibility into the last service delivery points, to the last mile.
Yeah,
thank you.
Thank you. That's super interesting. I hope that we have a chance to come back around and ask about some of the ways you overcame the obstacles of like inability to take a physical stock count and things like that. So we'll follow up with a second round of questions. But now I'd like to move on to Matiko and ask you about the inSupply experience in particular, and what are the most effective supply chain best practices from inSupply's perspective, and how do they help programs with their own supply chain management, and how do you assure that adaptation for local context? Loko mentioned it as well. So again, sort of best practices, how they relate to the work of the organizations who are your clients, and how are they adapted for local context? Thanks. You're on mute.
Sorry. Thanks so much, Carolyn. So there are a couple of best practices that really excites me. So I'll pick a few. So one of them is the use of human-centered design in creating supply chain solution. So this is the technique that we have used widely to problem solve and also customize our solution to local context. This methodology actually really helps in creating solution to user challenges and give it back to the actually put it back in the hands of the user. So that way we can move towards more of patient-centered supply chain and approaches. So that's actually one of the best techniques that we have used. So the other is the C-Stock platform. This is a reporting and resupplying platform that community health volunteers uses to report and also get resupplied. It extends the data visibility up to the last mile, and it has been adopted to even hard to reach communities and really link that data to the health systems and ensure community health volunteers are connected and also being resupplied with the system. The other approach that we've used is the applying machine learning and artificial intelligence into health supply chain. So currently we are developing the theory of change and theory of action for governments to really take their electronic logistic management information system to the next level. And this is through systematically and collaboratively thinking through what machine learning and AI should and can better serve the decision maker and managers, so that we can build robust ELMIS and vaccine information management systems. The goal for us is to move towards predictive rather than reactive health supply chains. The other best practice that really excites me is the virtual learning. So we have some e-learning modules that we have developed and customized to address the needs of impact team members, especially addressing their competence needs. And these self-learning modules really puts power back in the hands of health supply chain managers and other health system managers to monitor their professional development. They can learn at their own pace. They can do their competence tests to check their knowledge and skills acquisition. And the last one, which is my favorite, I'll say so, is the impact team approach. This is it's a people-centered and data-driven supply chain improvement approach. So overall, these are some of the best practices that we have used, and of course, using the human-centered design, and of course, with our staff who are based locally here, they understand the context. We have been really able to provide a solution that really address the client's need and respond to community needs here.
That's
Thanks.
fantastic. Thanks so much, Matiko. I I want to move quickly on to Suzanne, but I'm already excited about the second round of questions. So, Suzanne, let's put your first question to you. You have a somewhat more global perspective, although each of these gentlemen also deal with end-to-end global supply chains. But from your perspective, what supply chain best practices are enabling the kind of resilience we need to overcome disruptions like those caused by COVID this past year?
Yeah, no, absolutely. I would definitely say that COVID has presented some challenges, unique challenges that those of us that have been in supply chain for 20 years or more have never experienced, not on this scale at least. And some of the things within PFSCM that we've focused on to ensure that we maintain that resiliency is to do things like ensuring we have a diverse and properly mapped supplier base. Ensuring that you really understand where those suppliers are, where their sources of supply are, really contributes and ensures that you've got that diversification that you need to make sure that you can get the supplies when you need them. We've also looked at technology. That's been a huge and critical point, as both Matiko and Loko had mentioned. We've looked at it from the standpoint of looking at integrated technologies that allow for real-time data exchange with our partners, and also ensuring that we have the visibility we need to help make data-driven decisions, because it's absolutely critical if we want to be able to have that resiliency and navigate the challenges that we're experiencing right now with COVID from end to end. You've got to have that visibility to really understand and make the right decisions so that you can keep it moving forward and really meet the needs of the people that we're serving. And then finally, looking for creative partnerships. In supply chain, you can never work in isolation. Every organization, you have to have partnerships that you rely on, and getting really creative and seeing ways that you can work together really help to manage in these types of situations. So all of these types of techniques have helped us maintain our resilience and ensure that we're able to maintain our service levels for the clients that we're serving, not only directly, but those that we're trying to meet the needs in the countries where we're shipping these goods into. So it's really important that we look at some of these basic best practices, and this can be universal across not only in the public health sector, but also in the private sector. We do a lot of partnerships there, and these are very universal concepts that translate and work very well.
Oh, that's fabulous. I love that we have the global and also the deep country experience represented on this panel. And so I'm happy now that we get to go around for a second round of questions. And again, just for people who are logging in on Facebook, if you want to tell us where you're coming from, that would be great in the comments. Thanks. So second round of questions coming to you, Loko. Dr. Loko, you mentioned the need for significant investment in supply chains as one of your comments, that was a requirement. And so when you think about investments to come, what developments would you like to see in the supply chain realm in the near future? Where would you like to see those investments go? And what would you like to see develop in the near future based on your current knowledge?
Thank you, Caroline. So I think, like my colleague said earlier, after I respond to the first question, I genuinely see, we need to work very hard to make sure that we have that end-to-end visibility, and whatever data is generated from these digital tools are used for decision making across the board. Yes, we know that the COVAX is coming in, the COVID vaccine, and we have to create a platform that we have the capability to actually trace each vial and perhaps track its distribution. So again, we need investment in the area of digital tools and making sure that we have end-to-end visibility. And in a nutshell, the track and trace initiative, where we are spearheading a similar initiative now in Ethiopia. But I think that has to be, we have to make sure that we have similar platform for commodities beyond COVAX and selected few program commodities. That's one. Second would be, again, leveraging the experience of the JSI's work elsewhere. I think it's now the right time for national supply chains to actually do segmentation and perhaps move into differentiated service delivery, basically within the health system. So I don't think, I think it's now proven that there is no single magic solution for the different types of commodities customers that we serve. So I think it's the right time to invest more in making sure that we have that segmentation within the supply chain and services are differentiated, basically prioritizing those who need that support. Maybe the third piece is working more. Again, Suzanne has mentioned the partnership and collaboration. I would like to underline that. Without partnership and collaboration, our efforts will not be recognized, or at least they will not be felt as the last service delivery point. So it's time now to collaborate more, partner more with all actors, and particularly drive country ownership and making sure that we support countries for sub-regional, regional, and continental integration. You might have heard about, initiatives like the African Medicines Association and the African Free Trade Agreement and so forth. So I think it's up to us and the wider stakeholder to actually make sure that we invest more in these initiatives, so that when we have the second epidemic like COVID, we're better prepared.
Yeah.
Thank you.
Yeah, thanks. I love the very large perspective of sort of focusing on technology and information technology in particular to provide integration and visibility, but then the thinking about segmenting our supply chains, basically the way in which we perform the functions for different products, thinking flexibly about that. I feel like that's a really great point that you just made. So, okay, Matiko, when your second question, I want to go a little bit deeper on impact teams, because when you mentioned some of the best practices that you have found to be so effective with your clients, I think you said your favorite was impact teams. So could you speak a little bit more about what they contribute?
Sure. So I'll talk a bit more of what are these impact teams. So these are multidisciplinary teams that meet routinely, review the performance data. They do the root cause analysis as part of the problem solving and come up with action to improve the performance. These teams are at some at subnational, some at facility level, and they focus consistently and constantly looking at data. And as we help to build their capacity in data use, we really empower them to look at their challenges and come up with a feasible solution to address those challenges. So through that, we believe if all the teams at different levels, they are able to solve their challenges locally, then we can build a resilient supply chain. As we know, data alone is not enough to be responsive and resilient. It's until data, if it's effectively being used, and the impact team approach is one of the part that fulfill that ecosystem where you have data, visibility, ability to use data, and to locally problem solve challenges that are there.
Fabulous. And it connects to that human element, then the human-centered aspect that you also spoke to.
Exactly.
So Suzanne,
yeah.
moving to you, Suzanne, the last round of questions. Can I come back to one thing you said as well, which was the importance of I think you said a diverse and mapped supplier base. I think that sounds important to your work and important to the resilience of supply chains. Could you go a little deeper on that?
Sure, absolutely. You know, anytime you're dealing with supply chains and looking at your sources of supply, making sure that you've mapped that and then it is diverse is absolutely critical to make sure that you've got multiple sources of supply. If all you're doing is looking at your tier one, it's not really deep enough. We've seen multiple times organizations where they've diversified their tier one suppliers, those that they're buying their goods from, and think that that's enough, that they've now mitigated the risk of, you know, any kind of shortfalls or shortages in their supply chains. And what we wind up finding is that when you don't look any deeper, all of those suppliers could be sourcing from the exact same source of supply or a much smaller pool of suppliers, and in which case we really just perpetuated the risk. We really haven't mitigated it as much as we need to. So it's absolutely critical to ensure that we look deeper into the supply chain so that we see, give that visibility really to the raw materials and the capacity that these suppliers are utilizing to make sure that there's enough to meet the market needs. One area that we've experienced this directly is within the HIV and the COVID-19 diagnostic space. There are enough manufacturers with enough production capacity to meet the needs of the market for the diagnostic products themselves. But the problem that we experience is in the ancillary supplies, the supplies that are needed to be used within that the diagnostic tests. There is a major, there's limited supply and shortcomings around things like pipette tips, things like PCR plates, and deep well plates, which these are all items that are used in both HIV and COVID-19 diagnostics. So without these products, you can definitely experience programmatic impact programmatic health outcomes for sure. So, you know, here at PFSCM just earlier this year, we floated an RFP for some of the diagnostics, the nasal swabs to be utilized with the diagnostic kits. And part of the analysis that we did was for any respondents that did submit a response was to look at their sources of supply and capacity to ensure that we were diversifying enough and that we had enough sources to meet the needs for the programs that we were supporting. So it's really important that you're looking deep within the supply base to make sure that you've got enough diversification there to meet the needs that you're trying to support, because otherwise we may think that we've looked deeply enough and we may think we've diversified enough, but may find out later you have one disruption deeper in the chain and suddenly it's impacted not only you, but everyone else downstream.
Yeah, that's real world experience and a really great response to map and think more deeply, layer by layer. Thank you so much. I've enjoyed seeing you guys so much because we haven't actually seen each other in months. So excuse me, I just want to say thank you to my colleagues and panelists. I want to wish the folks who tuned in on Facebook Live and who are going to watch later a good morning and a good day. Suzanne, best wishes to you and PFSCM for the year ahead. Loko, same to you and the Ethiopia Digital Health Activity. And Matiko, to you and inSupply in Tanzania in particular. So thank you guys so much. I feel like we could talk all morning or all day, and I would really welcome that, but this is not the opportunity. So thanks a lot, you guys, and all the best.
Thank you.
Thank you so much.